Hi, everyone. This is a mini lecture on compliance bias. I actually gave it at an event a couple of years ago in Washington, D.C., but it's drawn directly from some of the readings that you're doing this week, and I think will help illustrate some of the concepts in the Gigerenzer as well. So kind of a response to the Taubes and Gigerenzer, but focusing in on compliance bias. What do we mean by compliance bias and why is it a problem? So I have some slides. Here we go. Perhaps the most enduring insight of my dissertation research is that beliefs about food and health typically precede any evidence and then shape the search for evidence and the interpretation of it. One example of this in the world of human nutrition research that keeps me up nights is how compliance bias undermines attempts to understand how differences in things like fruit and vegetable intake, to the extent that we can measure it, are related to health outcomes that we care about, like heart attacks and cancer. Historians like Charlotte Biltikoff and Helen Zoe Veit have documented a dramatic shift in attitudes towards fruits and vegetables in America following the discovery of vitamins between 1910 and 1920. Before we knew about vitamins, fruits and vegetables were predominantly seen as nutritionally empty, useless, if often delicious foods that children in particular were prone to overeat at the expense of more nourishing, if bland, grains, dairy, and meat that were thought to compose a healthy diet. Here's a fruit stall from that era in Washington, D.C. In the 1896 treatise, A New Era for Women, Health Without Drugs, and I'm quoting here from Veit's excellent book, Modern Food, Moral Food, quote, one doctor and expert publicly boasted that he had taught his children that fruit had no nutritional value whatsoever, and that his sons could walk by fruit stalls without feeling a twinge of temptation. As late as 1911, US government nutritionist Charles Langworthy argued that fruits and vegetables were nutritionally void, and any faith of their health value is superstition. End quote. And I think that word superstition gets at something important, right? The idea that there really were invisible substances in our food that might be essential to our health, this is what vitamins are, was a really hard sell for many doctors who had spent the 19th century asserting that their profession had legitimacy precisely because it was not witchcraft that involved mysterious or magical invisible mechanisms. But evidence mounted of both the existence and relevance of vitamins to the health of many unfortunate lab animals, and then was confirmed in the natural experiment of vitamin fortification and the subsequent decline in conditions like goiter, rickets, beriberi, and pellagra. And by this, I mean literally there were nutritional deficiencies rampant in the population. And then as we started doing things like adding vitamins to flour and other cereals, to milk, vitamins A and D in milk, right? Iron in cereals. All of these things really, really cut down on the nutritional deficiencies that were caused by the lack of these vitamins. The importance of fruits and vegetables to a healthy diet became sacrosanct. Not because anyone had ever had any evidence that eating fruits and vegetables could prevent heart disease and cancer, which were not the major health concerns of the early 20th century anyhow. And so far, neither epidemiological data nor controlled trials give me any confidence whatsoever that they do. I don't think fruits and vegetables are very good at helping us avoid heart disease and cancer, and I'll show you why in a minute. As a result of the fact that eating fruits and vegetables has become a form of conventional public health advice and popular wisdom for the better part of a century, people who do eat more fruits and vegetables are just different from those who do not. And I don't mean different in ways that we can measure, like income and smoking status and leisure time physical activity. They're different in those ways too. But they're what sometimes get called in the literature, I suspect they are, healthy users or good adherers, or more colloquially, Girl Scouts. Slide, go. There we go. Girl Scouts are people, people who eat lots of fruits and vegetables are ones who just do not belong in detention, and they behave differently in unmeasurable ways from the delinquents who practically live there. How big is this Girl Scout effect? Well, in a 1970s clinical trial of 5 different drugs with the potential to prevent heart attacks, researchers discovered that subjects who took more than 80% of their randomly assigned drug had much better outcomes. Only 15% of them died, compared to 25% of the poor adherers who took less than 80% of their pills. So the drugs worked, right? Not so fast. Fully one-third of the subject pool was assigned to take a placebo. And among the men who took more than 80% of their placebo pills, only 15% died, compared to 28% of the poor placebo adherers. As statistician David Freeman told journalist Gary Taubes in the piece that you read, quote, faithfully taking the placebo cuts the death rate by a factor of 2, end quote. Why? We don't know. There's just something different about Girl Scouts and delinquents, a difference that controlling for all the controllable factors does not eliminate. Keeping in mind the magnitude of this difference in the death rate attributable to compliance bias and the century of uninterrupted advice to eat more fruits and vegetables, I want to show you the data from a 2017 meta-analysis of fruit and vegetable intake and chronic disease responsible for these headlines, which you may have seen a couple years ago, about how eating five servings of fruits and vegetables a day is not sufficient for optimal health and longevity, and you should really aim for 10 or more. So here's the differences in the actual outcomes collected in this meta-analysis. And I have converted these into natural frequencies, right? This is not how the data table in the study looks. This is how I think data tables should be represented, right? To give you the best representation of the data. And just to explain what we've got here, right? So this is in that big meta-analysis that collected all of these observational studies, what people ate and what their disease and what rate of disease they had. The base rate for each of these kinds of disease across the population is right here, right? 23 out of 1,000 for heart disease, stroke, cardiovascular disease, cancer, all-cause mortality. This is the rate for the people who ate fewer than 2 servings of fruits and vegetables a day, right? A little bit of avocado on your nachos and maybe some green pepper on your pizza. That's this column. 500 grams a day is about 5 servings, the kind of standard recommendation. So this is the benefit that you're supposed to get for eating the current recommendation of 5 servings a day. And then this column, 800 grams a day, is the 8 to 10 servings that they're saying that people should actually aim for. So these are the differences. And then what I've done over here is, remember from the Gary Taubes article, he said, well, how big should a difference be, an observational difference, before we think it might be causal? And they said 3 to 4 times. So I've taken the lower end of that range and just replicated it here. How big of a difference would we want to see to think that something might be causal? And to remind you, when we have effects that we really think are actually causal, like cigarette smoking and lung cancer, the associations are not threefold. They're like 20-fold, right? 20,000% more likely to get lung cancer if you're a pack-a-day smoker. And that's also an effect that scales, right? So people who smoke a little bit are a little bit more likely to get lung cancer. People who smoke a lot are a lot more likely to get lung cancer. So that's a good effect that scales. Some of these don't even, are any of these not linear? This one certainly doesn't, right? Cancer doesn't seem to have much of a relationship at all with fruit and vegetable consumption, which I think is surprising given the ways that we talk about fruit and vegetables and what they're supposed to prevent. All right, so here's the data. 2000, eating more than double the official government recommendation was associated with 2 out of 1,000 fewer heart attacks compared to eating 5 servings a day, which is associated with a mere 4 out of 1,000 fewer heart attacks than eating less than 2 servings. The results aren't much better for the exceptionally frugivorous in terms of their incidence of stroke, cardiovascular disease, cancer, or all-cause mortality. So then I explained the column on the left, right? If eating more fruits and vegetables actually prevented heart attacks, those are the minimum numbers I'd want to see in the far column, if not in the middle one, right? I'd want to see those at 5 servings a day to think that eating 5 servings a day is going to have a meaningful reduction in any of these conditions. This is the number I should see here. And then it should be even lower for 8 to 10 if we really think that's a benefit. Nonetheless, the researchers looked at these numbers and concluded, and I'm quoting the lead researcher here in The Guardian, quote, "We wanted to investigate how much fruit and vegetables you needed to eat to gain the maximum protection against disease and premature death. Our results suggest that although 5 portions of fruit and vegetables is good, 10 a day is even better." So they've already leapt from association, right? These conditions are associated with greater fruit and vegetable consumption, to assuming that it's causal, protective. They use the word protective. Fruits and vegetables are protective. When I look at these numbers, what I want to know is why the people who report eating 10 or more servings a day of fruits and vegetables aren't any healthier. Either we accept that our intake measures, right, the food frequency questionnaires and 3-day diaries that people use to calculate what people are actually eating, have no relationship at all to how people actually eat, and then our data just have no external validity, right? Or we have to accept that this analysis, like virtually every other one I've seen, suggests that the consumption of foods in this category called fruits and vegetables, that includes everything from grapes to avocados to fresh coconut meat to fried okra to sweet potato fries, is not itself a primary determinant of chronic disease outcomes. Good news for the delinquents. Sometimes I wonder how much of the interpretation of nutrition research is explained by the possibility that the kind of people who go into the field are overwhelmingly likely to be Girl Scouts. Is the whole field affected by a kind of meta-compliance bias? I'll leave that for you to decide.